in Durham, North Carolina. I'm thrilled to welcome you all to our third Community Education Series event of this school year. For those of you who aren't familiar with Hill, we are a K-12 education nonprofit that exists because sometimes mainstream instructional practices don't serve all students, including those with both diagnosed and undiagnosed learning differences. Our vision is that all students with learning and attention challenges receive the instruction and support they need, regardless of where they attend school or whether they have a formal diagnosis. We pursue this vision through a range of student and educator programs and knowledge and field building efforts that reach students and educators in Durham and beyond. If you haven't already, I encourage you to check out our website at hillcenter.org. Through the Community Education Series, we aspire to offer free, practical, research-based strategies to help students as well as the parents, teachers, and professionals who support them. Before introducing our speaker, let me cover a few housekeeping details. So as you just heard, the session's being recorded, and that'll be sent out tomorrow along with a short survey. Please complete the survey. Your feedback is really important to us in developing future sessions. There's a link to the slide presentation in the chat, and the slides will also be included in tomorrow's email. You all are muted, but you're welcome, and please do submit questions and comments to the presenters and the team here at Hill anytime using the chat. The chat is only visible to the presenters as well as the team here at Hill. Dr. Preston and Ms. Maternowski will present for about an hour, and then we'll have a Q&A based on the questions you submit, which I will moderate. So thanks for joining us, and now it's my distinct pleasure to welcome Dr. Andrew Preston and Ms. Margaret Maternowski. Dr. Preston is a clinical psychologist specializing in pediatric neuropsychology at the Chapel Hill Pediatric Psychology Practice. He completed his internship and postdoc fellowship at Brown University Medical School. As a pediatric neuropsychologist, Dr. Preston specializes in understanding how the brain functions and how it impacts learning, behavior, and other cognitive skills that are important for daily functioning, such as academic success. Dr. Preston has published research and made presentations at numerous professional conferences. I have a strong personal affinity for Andrew, as he often wrote assessment reports for students that I served as a special educator, and I always found them to be thorough and a great guide for how to effectively provide instruction. Margaret Maternowski holds a BA in elementary and special education from St. Mary's College of Notre Dame and a master's in special education from Duquesne University. Margaret began consulting with Chapel Hill Pediatric Psychology after a 20-year career as an exceptional children's program facilitator in the Chapel Hill Carrboro City Schools. In this role, she assisted hundreds of families in navigating a complex educational system, helping them to chart a path to success for their child. She's got extensive knowledge of both North Carolina and federal laws that guide the IEP process, and she has facilitated countless IEP team meetings, consistently bringing team members to consensus. We're lucky and grateful to have them as part of our Hill community and with us here tonight to share their expertise. So let me turn it over to Dr. Preston.
And good evening, and thank you for the introduction. And tonight, as you know, we'll be talking about the evaluation process, and I'll be walking you through what the evaluation itself looks like. And then we'll be talking after that about the IEP process following an evaluation. So in terms of the evaluation process, this is describing the evaluation from the perspective of parents, so you have an idea of what to expect when seeking an evaluation, what happens when your child undergoes an evaluation, and then the types of uses of the evaluation. So the overview really is to go over what an evaluation really is, what you should seek, when you should seek an evaluation, and that process, and then what you gain from the evaluation. So in terms of evaluations, this is a very general term. There are many different other more specific terms we use for evaluations. So the types of evaluations I perform are called neuropsychological evaluations, which look at a range of different cognitive abilities and also often encompass educational skills and social and emotional functioning. Another term that we commonly see for the evaluation is called psychoeducational evaluation. And oftentimes these are used interchangeably, but a psychoeducational evaluation more specifically talks about looking at a child's educational skills and often also includes other aspects of functioning like their intellectual skills. Neurocognitive functioning is another term that we see with some of these evaluations, and that's often used interchangeably with that neuropsychological kind of evaluation. So, we see those two terms, we sometimes mix them and sometimes can be confusing to parents, although they're really essentially talking about the same type of evaluation. And then sometimes an evaluation will just be called a psychological evaluation. And that can mean any range of things. It can be a psychoeducational evaluation. It could be a neuropsychological, or sometimes that term is used when the type of evaluation is really looking more at a child's emotional functioning. And then the last term you'll see there is developmental evaluation. And so again, this term can be used interchangeably with these others, but often that one will be used when we're talking about evaluating earlier developmental stages with children, or sometimes when we're talking about evaluating children for social communication types of concerns like autism. In all of these, really the goal of the evaluation is really to assess areas that of the concern usually reported by parents, and to assess that in a standardized way. So oftentimes parents will come in and ask, is this within the normal range? Is it something we should be concerned about? And so the assessment is really comparing a child's abilities to a standardized sample of other children within that same age, so we can understand whether or not there is an area of concern that's outside of just the normal range. And I always try and tell parents, we're not only looking for concerns. Of course, that's what we spend a lot of our time talking about, but we also want to understand what is a child's strengths, what are things they can rely on or lean on when they do have other areas of weakness. So it's not just understanding difficulties, but also what are the things that a child could rely on or use to sort of work around some of their weaknesses. In many cases, the diagnosis is a question. So we want to be able to confirm a diagnosis or clarify a diagnosis. But again, it's not just to look at a diagnosis. It's really to look at how is a child learning, how do they process information. Obviously, sometimes a diagnosis we're going to talk about the IEP process and qualifications, but in terms of an evaluation, that's not the only thing we're looking at. We're not just looking to put a label on a child. And then ultimately, of course, the main goal is to provide treatment recommendations to the parents, the school, and potentially medical providers. So the evaluation process, these are not necessarily discrete processes, but some of the things that we want to look at. So one of the things that a lot of people don't realize is that the history we gather about the child is probably the most important thing that we do in an evaluation. Sometimes parents will call and they'll say, can we just give them the battery of tests? That's not really how it works. We really want to look at, going into an evaluation with a good sense of what are the concerns, and the clinical interview is one of the most important parts of that. We can, with a clinical interview, really understand what types of concerns there are, what types of diagnoses we should be looking for, and also how does our test results correlate with what parents and others are seeing in the real world. Record review is also very important. So understanding any previous evaluations or other records so that we can, again, look at how do our results line up with what people are seeing at other time points or in other settings. Our evaluation, though objective, is only one setting, and so on its own may not be as helpful as when we can look at a confluence of information across multiple settings. And then again, information from teachers and schools. So typically gathering both some checklists we'll talk about, but also just narrative information from the teachers is really helpful. Another part of the evaluation is really getting some standardized questionnaires and checklists from parents and teachers, and often from children, which again look at a more standardized way at how are people observing or viewing the child in different settings. And then the behavior observations of the child during the evaluation are very important. So we'll get some results, but we also want to understand how did the child achieve a certain score. So we want to look at what's a child's effort level, their level of attention, their behaviors during the actual testing, because that can really help us understand what it's like to interact with the child, and also how some of these scores should be interpreted. And then the last piece is actually the formal evaluation, which is the standardized tests that we administer to children. And these are typically paper and pencil tests or conversations or things that we discuss with the child. Again, they're usually done in a standardized way so that we can really compare how they perform compared to others their age group. But most of the things really are not just hooking a child up to a computer program and seeing what happens. That is not our goal. Our goal is really to see, again, how does a child do with hands-on kinds of tests, again, conversations and discussions with them. And we do have a couple computerized tests that we sometimes use to supplement these other areas. The domains we typically assess, and again, this can depend. It depends a lot on the history that we get from the parents and teachers in terms of what the concerns are. And most evaluations are designed to look at a range of different areas so we can really get a comprehensive look at the child's processing, how they learn, how they understand things, and how they solve problems. And so we look at intellectual ability, which is commonly known as IQ. I always try and tell parents IQ is overrated in many situations. There's a lot of attention paid to what's their IQ. It's not that it's not important, but it's not as important as the kind of public would have you believe. There's a lot of other factors we really want to look at. And even within intellectual ability, there's a lot of different factors within that. We often look at language processing and visual motor processing. So we want to do some screeners to understand, are there areas of the child's ability to understand or use language, their ability to see and interact with visual information that could be helpful to know. Fine motor processing, again, is looking at their dexterity, their ability, again, to draw, copy things, write. Again, understanding, is that an area that is of concern? We also spend a lot of time looking at the child's ability to learn and retain information. These are not things they've already learned, but looking at how well do they do when something is visual, something is verbal or auditory, learning things that are organized or less organized. So really understanding what is the best way to teach the child and how do they learn and process information. In many cases, we look at attentional skills, so how well a child focuses, their distractibility level, ability to stay on task, and that can certainly affect a lot of different areas of other functioning. And then we look at executive functioning, which is understanding things that are related to organizational skills, processing speed, just the child's ability to kind of self-monitor, self-regulate, direct their resources toward achieving some kind of a goal. And the other things we often look at are the social and behavioral and emotional functioning. So this is done again through some observations and questionnaires and checklists with the child and interacting with the child, but those things can often be very important for understanding the child's functioning, both in understanding how is it impacting their learning, and also how is learning impacting those skills and those functions. So children who have difficulties with learning or attention are often getting a lot of negative feedback about their performance throughout the day. That can certainly have an impact on how they feel about themselves, how they interact with others. So that's something that we really want to understand. And then adaptive functioning is really looking more at basic daily living skills and communication skills in their environment in both school and at home. So the other area we often look at is, of course, educational skills. And so typically we look at reading and writing and math. And within those, we want to break them into their components to understand if there are any difficulties where they might be. So in reading, we would look at basic skills like decoding or phonological processing. We also want to look at their fluency or automaticity. So many children are able to sound out words accurately, but they take a lot more time and it's much more effortful. And that can certainly affect that third piece, which is comprehension. So children who may have difficulties in either phonics or fluency often can affect comprehension. Other children who have difficulties with language processing may have difficulty with comprehension, although other areas of reading may be intact. So we want to understand their reading skills so we know how to provide appropriate interventions. Similarly with writing, we look at a number of different areas there, but I think that the rule of thumb is really looking at some more basic skills like spelling, use of conventions in writing, like understanding a structure of a sentence or punctuation, and then kind of higher level writing, like their ability to really express an idea in writing. In math skills, we typically look at calculation skills, so just being able to understand how to crunch different kind of numbers or arithmetic. Look at their problem solving skills, so some children may have difficulty with calculation, but may actually understand the concepts of math fairly well. And then their fluency, so again, just speeded math facts, how automatic are they with those skills? So, a lot of parents, of course, wonder when should you seek an evaluation? And this is can be a really difficult question. I think these are some guidelines I'll include. Obviously, doesn't encompass everything. But again, many parents, of course, as their child is developing, wonder if this is a normal or not, outside of the normal range for development. How long should we wait before we get an evaluation? And those kind of questions. And so some just general ideas about that. There's certainly kind of, I would call, obvious reasons to get an evaluation. And these are things that are typically picked up at school or by parents, but certainly if a child is not meeting the academic standards for their grade, that's when we want to think about why that might be. Are there any underlying difficulties with learning or attention or other areas that we would want to address? And so certainly that's a clear reason we would want to seek an evaluation. Obviously, if a child also, again, is having significant behavior problems at school, disruptive behavior, or having difficulties that certainly the school would recognize that are disrupting their social development or their academic progress, then we certainly want to look at why that might be. And another reason would be that if a child already has a diagnosis, but they're not responding to the interventions, and there's a concern about what else might be going on, is there something else that is being missed that we want to address? Some other reasons that I included here, because these are maybe a little less obvious at times, but one of them is that although the child's meeting the basic standards, they're not seeming to perform to the ability level that teachers or parents might expect, or their performance is very inconsistent. So oftentimes we'll hear about a child who kind of pulls it all together at the very end of the semester, but we're struggling kind of throughout that semester. Or there's children who start off very strong, then they really kind of taper off and then kind of pull it together again at the end. And sometimes that can indicate some difficulties with learning or attention that we'd want to address. So that's not a consistent difficulty. That's certainly stressful for children and parents. And oftentimes we find that pattern is going on for a couple of years in a row, that at some point that child will likely hit a wall and they won't be able to catch up enough and won't be able to make up that difference. Other reasons are if a child is meeting the standards, but at a great cost to other areas of their life. So maybe they're studying, but they're spending 4 hours a night to do so, and it's causing them great stress and anxiety, or causing parents great stress. It may be that parents feel like they are having to really do a lot of the work to help the child get the grades that they need or get the standards they need. And so even though the child does make the grades, that the parents are feeling like there's an undue amount of work that they're putting in for the child. And that may be another reason that there's something else that may be going on that should be looked at. And then another reason would be that although behavior at school is okay, there are significant problems when the child gets home. And so we do see this a lot, actually, where teachers may say, this child is doing well, we're not really seeing any problems with their behavior or their frustration. But then when they get home, they're kind of tapped out and they've used all the resources and they're just really very irritable, very touchy, very difficult to work with, and parents are struggling to figure out what's going on. And that may be an indication that the child, although they're behaving at school, is really working very hard to just kind of hold it all together at school, which again may indicate some underlying difficulties that aren't clearly evident to the school. These are also just some common diagnostic questions that we see. So I've included a few. Again, it's not comprehensive, but some common things that parents wonder about. One would be, should I get an evaluation for my child if there's a concern about ADHD? And in many cases, children with concerns about ADHD can go to a pediatrician and complete checklists and get an accurate diagnosis and get accurate treatment recommendations. So certainly not every child with a question about ADHD requires a comprehensive evaluation, but a few examples that maybe would merit an evaluation. One would be really when observers' reports are not consistent. So parents may see one thing, teachers may see another, or within the family or between teachers, there may be some disagreement. And so sometimes a evaluation can help to really hash that out and determine whether it seems that there are some attention deficits or not. The other things, we often catch the children who have more hyperactive or impulsive behaviors because those are much more external. And so schools will typically notice those fairly early on, or parents. But many children have more quiet types of ADHD. So there may be just inattention, which doesn't outwardly always present. Child may look like they're paying attention, but internally may not be. We also want to look at things like executive functioning skills, particularly as children enter middle and high school. The demands on organization and time management and self-drive really increase. And so we want to understand, where if there's a problem with attention or ADHD that might be contributing to those things. I also mentioned earlier, just understanding more kind of the potential impact of ADHD. So again, on social relationships or self-esteem. So a child may be doing well academically, but has difficulties in social situations or with their mood or self-esteem. Other things that can commonly occur with ADHD are learning disabilities, dyspraxia, which is difficulties with some motor planning skills, and anxiety. So again, understanding how those might be affecting the child. And then also just to assist with treatment planning, so helping with potentially determining, whether medication is effective or not, helping with accommodations at school, which we'll talk about in a minute, and then also helping with older children with what we call academic coaching or executive skill building, so helping understand other strategies or types of skills that a child could benefit from. Again, with learning disabilities, we are all wondering about really understanding the child's strengths and weaknesses and helping to guide interventions with that profile. Also helping, again, supporting the child with evidence that they would benefit from interventions or accommodations at school. If a child's been getting interventions, we can help with understanding what is the progress. Are they making sufficient progress, or do we need to make some changes to that intervention? And then again, understanding other factors. Many children with learning disabilities have additional executive functioning weaknesses, and many can also have more general difficulties with verbal or oral language processing. So those are things that we would like to understand better because it can certainly guide intervention. Another thing I just added here is for concussion management. And again, in many cases, children with a mild concussion do recover relatively quickly, and there's no need for an evaluation. But in some cases, children don't recover as we'd expect. And we would want to understand what types of accommodations and supports might they benefit from. This tends to be a more temporary kind of accommodation plan. So it would be probably more under what we would call a 504 plan, which we'll talk about a bit more, rather than an IEP. But it would help many children who are having difficulties returning to school or adjusting after a concussion. And these are some other common questions that parents may have when they're thinking about evaluations. The most common probably question that I get is just really, we don't really understand what's going on. We're not sure what's happening. And we just want to learn better how my child is learning and how they're processing. And so those are some things like there's slower processing speed. Maybe they're having memory difficulties. Children with intellectual disabilities or concerns of those can be important to evaluate. I mentioned autism earlier. We also see children with neurological conditions like seizures or stroke, genetic or developmental conditions that might be affecting their functioning. Children with more severe head injuries, and children who have had radiation or chemotherapy who often experience some neuropsychological and cognitive impacts. So in terms of the evaluation process itself, it starts with a referral to the office, and that's typically done by a parent or sometimes through a physician. You don't need to have a physician refer, but parents often will either refer directly or a physician will recommend an evaluation. And during the referral, it's really a brief description of the concerns and the goals, just to get a general idea of the type of evaluation that might be helpful, and a brief description of the medical or psychosocial history. The intake is really the time when we get much more in-depth information from parents. And this is usually about an hour-long meeting with parents to really discuss what are the concerns, the child's medical and developmental history, their social history, educational history. So we really try and go in depth to really get a comprehensive look at the child. And again, as I mentioned before, this is really one of the most important parts of the assessment. Without the intake, it's very hard to know kind of the meaning behind or context behind our results. So this part is one of the most vital pieces of information. And also at that time, we would discuss what other documents that we might want to gather before we began the evaluation. At that time, at the end of that intake, then typically there'd be a discussion with parents about what type of evaluation might be helpful, kind of what you would get out of different types of evaluations, and then discuss. Sometimes maybe makes sense, we'll wait a little while, sometimes it makes sense to proceed. So that's another point where we decide, should we proceed with an evaluation? And if so, what kind of evaluation would be helpful? Hopefully at the end of the intake, parents do have a sense of next steps in terms of what the evaluation would include. In terms of the actual evaluation, so I already mentioned this a little bit, but again, these are paper and pencil tests, discussions we have with the children, and just again, they're more interactive, more game-like. Some of them are certainly boring, probably some by design, but it's not like sitting through the SATs or sitting through a 2-hour paper just written exam. The children are typically find some of the things to be enjoyable. Again, some certainly not enjoyable, but it's not, again, sitting for a 2-hour kind of lecture or examination. Parents often ask, what should they tell their child to help them prepare? And it really depends on the child. I think in many cases, especially with somewhat older children, they already kind of know something isn't working, something's not going right, and they probably don't have a good name for it. But often parents can use that when they're describing why this evaluation is happening. So, first thing we always tell kids when they first come in is, again, that nothing hurts. It's not like a typical doctor's visit where you're going to get any kind of shots or anything like that. And that really the idea is to understand how they learn, how their brain works. Again, for kids where parents have a sense that, yeah, they know they're struggling with reading, then we might say, we're going to learn some tricks on how to help you with reading or how to help you with other areas that might be difficult. With children who have attention difficulties, I will often just say, how we find out that, how we notice that, you have trouble when things are kind of boring. I mean, most of us would say yes to that, but that's an easy way to kind of relate to the child. And they say, oh yeah, I do feel like that. Okay, well, we really would think it'd be helpful to figure out how your brain works to help you with those kinds of moments. And those are usually things that a child can relate to. It's not very scary. Then we often get children settled in anyway during the evaluation with some fairly easy or simple tasks, some discussion. So by the time they get in the door and then they're working with us for just a few minutes, they're really pretty comfortable and settled in. Other note, I just always encourage children to try their best, and for parents to also tell the children that. On a couple of occasions, parents have told the child there's no right answers. That's not exactly true with a lot of the things we do. So that's not necessarily the most helpful thing to tell them, but we do always tell them to try their best and just work hard, and that they don't get a grade or anything like that. So what do you gain from an evaluation? And so the main thing that parents gain is really the interpretation of the results, because that will help where we would go over these results with parents. This is again about an hour-long type of discussion where we review these results, beginning with really kind of the test results themselves and the results of those checklists that parents and teachers complete. And then really thinking about, based on that, what do those results mean? What are the implications of them? There may be a diagnosis that's appropriate at that time, discussion about the child's learning style. We try not to get too bogged down in any one score, because any one score typically doesn't mean that much. We're really looking at where is this confluence of data? What does all the data together really mean for the child? And then again, of course, really the main point is really to then discuss recommendations and next steps to help the child. So that would often be a different combination of things, but things that parents can do at home, certainly recommendations for school. If there's medical recommendations, we would think about that. And then in many cases with older children, we would also meet with them or teenagers to discuss these results in a very age appropriate manner. It's usually a much shorter kind of meeting, because children and teens often don't have that many questions, but sometimes it is very helpful for them to hear the information from us rather than parents. Particularly teenagers, they don't like to hear what parents have to say. The other things you gain from evaluations, really providing a copy of the report to parents. So this is just the documentation, and hopefully when you read a report, it's fairly repetitive from the interpretation of the results, because that's really what it's supposed to be. But this just puts it all in writing, and this is allowing you to then share that information with others. The only thing I mention here is that in most cases, the report is really the parents, and it's for the child. It's the parent's property essentially. We don't send that out to anyone else without a parent's express request to do so. And in many cases, we encourage parents to take the evaluation themselves to the school to make sure it goes to the correct people. One exception would be if the school or some other entity was paying for an evaluation in like a legal case, or again, if a school was paying for that. In that case, there's usually a different kind of contract. But 99% of the time, that evaluation is really for the parents. We don't send that out to anyone else unless they expressly request it. And then here's just some brief overview of the sections of the report. And again, usually it will have a reason for the referral, which is typically, again, when the parent first calls in, what their concerns are, a description of the types of tests that were used, the background history, which is, again, information that's gathered from the intake and review of records, then the results from the test themselves, summary impressions, kind of the big picture. And then again, probably the most important piece for parents and teachers is the recommendations and the treatment planning aspect of the report. Other things with the evaluation is just that there's ongoing communication and collaboration with school and other providers, again, at the parent's request. So that's not something we would just do without parent asking us to do that. And of course, ongoing consultation and coordination of care following that evaluation. So a lot of times after it's all done, parents may ask, well, what's next? In addition to the recommendations, of course, parents may hit snags when they're working with school or need additional support working with a physician, in which case, of course, ongoing consultation might be helpful. And then in many cases, a child may be reevaluated down the road, depending on the concerns, to monitor progress and update recommendations. So hopefully this gives you a general overview of kind of just what an evaluation is and sort of the process of the evaluation for your child and the process of kind of the information you would get after the evaluation. We're going to talk now about the actual implementation of some of these recommendations and treatment planning. I'm going to turn it over to Margaret to talk more about that process in terms of the development of the IEP.
Okay, can everybody see this? All right. So what I'm going to do is talk about the IEP process. I would like to make it known that this process is only for schools who accept federal and state monies. This process is not followed in a private school. They each have their own procedure. So you have the assessment done. What happens next? You have a private assessment, or you don't have an assessment. What's the next step? What should I do? Because you suspect your child has a disability. So there is a law that is called child find, and it is a very serious law that is very often neglected in the schools. And what child find states is anybody, a school personnel or parent who suspects that a child has a disability, it is the responsibility of that school to do the appropriate evaluations, informal assessments to determine whether a child does or does not have a disability. So again, it could be someone in the school who suspects the child has a disability, or it could be the parent. So now you really suspect your child has a disability. You may have a private evaluation. You may have no evaluation. So the first step in this process is you need to express your concerns in writing to the school. Okay, oops, sorry. Once the school receives your referral, they are required by law to convene a formal IEP team to review your concerns. Okay, at this meeting, they will complete a form that's entitled Special Education Referral. A formal IEP team consists of individuals, but is not limited to the parent or guardians of the child, if they are 14 years of age or older, at least one general education teacher who is knowledgeable about grade level curriculum or currently teaches the child, at least one special education teacher who serves the school that the child is enrolled, a representative of the school district who is qualified to provide or supervise the provision of specially designed instruction. That typically is a school administrator. And typically does not have to be, but typically there is a school psychologist, social worker, guidance counselor in this meeting that can kind of field the concerns. All right, so part of the initial referral meeting is they must review the information. That if the parent has provided a private evaluation, they must review that. And any additional information that the school has. So again, information provided by evaluations, but parents provided by the parents, current assessments, classroom-based, local or state, classroom-based observations by teachers and related service providers, and data from the MTSS process. If the child has not been referred to the MTSS process, this is part of placement, initial placement for an IEP. So I have several slides here about MTSS. I'm not going to go into a great amount of detail, but this is more of a reference for you. MTSS is the new kid on the block. In the past, the state used what they called a discrepancy model, meaning they took the child's full scale IQ and they compared it to the scores, the educational scores in reading, writing, and math. If there was a negative 15 points or more in any one of those areas, then the child was suspected of having a learning disability. Now, every child who is going to be considered for an IEP must go through the MTSS process. So the MTSS process is a 3-tiered system of support using data to help match academic, social, emotional, and behavioral assessment and instructional resources to each and every student's needs. In this tiered data-informed framework, educators work to ensure that the majority of students respond to core instructions. Students who need additional supports for enrichment or remediation are identified by data and provided that support with the right focus and intensity. The goal of MTSS is to move students into reduced interventions as they progress. So, Tier 1, every child in the school is technically in Tier 1. That is just your basic everyday instruction. When a child starts to struggle, they're moved up to Tier 2. And this is where the targeted or strategic instruction interventions come into play. All right, typically, these children are not meeting grade level standards. They need small group instruction. They need a check-in, check-out they need to meet with the counselor. They just in general need some extra support. And then when you get to Tier 3, this is the group of students that the previous interventions have failed. Typically at Tier 3, the school is going to make the referral to special education. All right, the things to remember about MTSS is the school cannot use this as a delay tactic in moving forward with the EC referral process. All too often when a parent has a concern, the team will say, oh, well, the child hasn't been through the MTSS process, so we can't move forward. The thing to remember is the MTSS process can run concurrent to the EC referral process. This MTSS process takes typically 6 to 8 weeks, but can take up to 10 weeks. Okay, so after reviewing all of the information, there are 3 possibilities. One is the team can say eligibility will be determined based on existing data. Okay, the second possibility is the team decides that they don't suspect the child has a disability. They do not recommend an evaluation. They may, however, discuss additional supports available to your child to address areas of concern. This will be done through the data collected in the MTSS process. Thing to remember is once the new data is collected, okay, and if more significant interventions are needed, this is when another referral can be made to the IEP team. Typically, parents are a part of the MTSS process. They have usually monthly meetings with the parents to tell them how the child is responding to interventions. Okay. They may not accept the referral, and they may say that the child is doing fine. The reasons why they would not accept the referral: the child's classroom performance, standardized tests, benchmark assessments do not show that their achievement has been negatively impacted. Okay, although there is educational impact, there is no suspicion of a disability. There may be educational impact, but the child is currently receiving interventions and is responding to those interventions, making measurable progress. Okay, parents have presented the team with an independent evaluation, but the information contained in the report is not characteristic of the child's performance. The child's physical condition would make the results of an evaluation at this time less than valid and would not necessarily be a true indication of the child's current level of functioning. So some physical conditions would be if a child were receiving cancer treatments, or a child had just recently had a stroke. If a child had had a traumatic brain injury, the school usually will want to wait until the child stabilizes before they would do any type of evaluation. Okay, they could also decide, yes, there is enough information here that we should move forward with an evaluation. Okay, so the point of the evaluation is to see if the child has a disability, what the child's educational needs are, the present levels of academic achievement and related developmental needs, and whether the child needs special education or related services. The evaluation will include a multidiscipline. The evaluation is based on, there's a standard list of evaluations that the state and federal government say must be conducted for each disability. There must be a multidisciplinary team to conduct the evaluation. In other words, it's going to be psychologists, speech language pathologists, occupational therapists, informal evaluations, observations. So it's a multidisciplinary team, but it's targeted to what the suspected disability is. Again, they must use more than one instrument to evaluate the child, and this is based on what the state and federal government, the guidelines they've put forth to say these evaluations must be conducted in order for this child to be considered for eligibility. Okay, evaluations must be administered in the child's native language. And again, the team must collect information from a variety of sources, which include observations, parent interviews, and they review any pertinent and medical history. The key points of the evaluation are they must address all areas of concern based on the child's individual needs. They must be conducted by trained and knowledgeable personnel. In other words, a special educator could not give a psychological evaluation. A counselor could not give a speech language evaluation. You must have the credentials in order to perform the evaluation. And the evaluation must be sufficiently comprehensive to identify all of the child's special education and related service needs. Okay, I included all of the assessments that I could possibly think of through all my years in the school system that could be conducted. And they are listed in slides 59 through 76 and fairly detailed description of each. So if you have a child, let's say, that is specific learning disabled and they're doing a speech language screening, a psychological and educational, if you go to these assessments, they're in alphabetical order, you can see what each of those assessments entail. Okay, one thing to keep in mind, which is really important, even if you come to the school with an outside evaluation, okay, the school does not, well, there's usually other assessments that need to be done, such as speech, language, vision, hearing, a medical evaluation. And also remember that if it's an independent evaluation, the team must consider the results. It's considered a data point, but they don't have to accept the outside evaluation. The school district has the right to say, we will complete our own evaluation. I have not ever seen that done in the school systems that I've worked with. If it's a reputable psychologist who is licensed in the state of North Carolina, they will accept that evaluation. However, again, the school district does have the right to conduct their own evaluation. Okay, there is a timeline, and this timeline starts with the day you write your concerns to the school and you ask them to consider your child for special education services. That starts what we call a 90-day timeline. It's not the day that you actually meet for the EC referral meeting. It's the day that you send that documentation, that request that your child be considered for EC services. That starts the 90-day timeline. And what that means is within 90 days, the school system has to complete the evaluations required by state and federal law. They have to convene a meeting to review those evaluation results. And then they have to make the determination as to whether your child is or is not eligible for special education services. Okay, before an evaluation can be conducted, you need to give consent for that evaluation. So I've had people call and say, my child was formally evaluated, I had no knowledge. If that is the case, that's totally illegal. There must be a meeting. The parent must be informed of what evaluations will be conducted, and they must give consent for that evaluation. If the school decides that the child has the possibility of a disability and they want to move forward with testing, but the parent does not want to give their consent, the parent has the right to refuse the consent. So what is also considered a refusal is they will give you at these meetings, or if the parent is not present at this meeting, it will be sent to the parent asking for their consent. If the parent does not return this consent form within 10 days, it's considered the parent refusing to give their consent. Okay, at the end of the referral meeting, the reason I have this in here, there is one very, very important document, and that is the second one, the prior written notice. Okay, this is the most important legal document that will be completed at the EC referral meeting. A parent needs to read this very, very carefully and make certain that what is written on this form is an accurate reflection of what occurred in that meeting. Because should you need to go to court, this is the document that the lawyers will put the most weight on. Okay. So you read the prior written notice, you read all the documents, and you find an error in the paperwork. What you need to do is immediately contact the HillRAP program facilitator, whomever conducted the meeting, and you need to say that there is a mistake in the paperwork. I also recommend that you follow up with this in writing. So that you have a written record that you have found an error and you are asking that this error be corrected. Okay, if you don't agree with the team's decision, you do have some steps that you can take. You can request a facilitated IEP meeting. A facilitated meeting is to no cost to the parent. It is in the dispute resolution section of the DPI website under exceptional children, their page. And it is a completely impartial person. Usually they are past executive directors for special education services, retired somewhere in the state of North Carolina. So if you had a dispute with Chapel Hill, they would not give you an executive director who had served in the Chapel Hill area. They may send someone in from Charlotte, in a whole different area, so that this person is completely neutral, has no affiliation with the school district. Okay, so the team decided to move forward to see if your child in fact had a disability. Now the assessments are completed. what happened. So again, a formal IEP team will be convened. They will discuss the assessment results. Again, this will be a multidisciplinary team comprised of a group of qualified professionals, teachers, and the parent. Okay, as we said earlier, the team must have drawn information from a variety of sources in accordance with NC policy. The team must ensure the information obtained from all sources is documented and carefully considered. And during this meeting, the team will complete the eligibility determination worksheet for each category of suspected disability. So when you met for the EC referral meeting, they will listen to your concerns. If they decide to move forward with assessments, they will identify what suspected areas of disability they think your child might qualify for an IEP. And that is what, again, drives the evaluations, because the state and federal government say there are very specific assessments that need to be given in order for a child to be considered eligible for various labels. Okay, so a child can meet criteria for 14 different disabling conditions in the state of North Carolina, and here they are. Okay, so when you get to the table and you're talking eligibility, a child has to meet all three of these criteria. The first is they have to meet one of the criteria for one of the disabling conditions. The disability must have an adverse effect on their educational performance, and the child must require specialized instruction. So a child can have a disability. It can have an adverse impact on their educational performance. However, the child does not require specialized instruction. So again, they have to meet all three of those criteria. Okay, the team will also determine what the child's current educational performance is not caused by: a lack of appropriate instruction in reading, including the essential components of reading instruction, okay? A lack of appropriate instruction in math, and not due to a limited English proficiency. When your child is eligible for special education, they then move forward and they write an initial IEP. This has to be done within, typically it's done within the 90-day timeline. But if it's not done within that 90-day timeline, it's typically done within 10 days of child being found eligible for services. It can go up to 30 days. Again, I've put in here the forms that you will get. The most important is the prior written notice. That is the legal meat of the meeting. Always read that very, very carefully. Okay, what is the purpose of an initial IEP? What does it look like? They'll develop present levels of educational performance for the child. They'll describe how the child is currently doing in school and how the disability affects their performance in class and the school environment. That's what a present level of performance addresses. Then they will write from that present level of performance annual goals and objectives. Annual goals will describe what a child is expected to do or learn within a 12-month period. If your child will be taking alternative assessments, they're aligned to alternative achievement standards. And those are typically children who are in self-contained classrooms. They also will note how progress will be made towards the IEP goals. and how the parents will be informed of that progress. They will identify what types of special education services the child will receive, what related services and what supplementary aids and services will be provided to the child. Okay, related services define the extra support the child may need in order to benefit from special education services. These are typically speech language, occupational therapy, physical therapy. If a child has visual problems, hearing problems, these are the types of services that they would receive through related services. Supplemental aids and services are intended to improve children's access to learning and their participation across the spectrum of academic, extracurricular, and non-academic activities and settings. All children must have an inclusive education. Okay, so if your child is not going to be participating in the general education setting, then there must be a statement as to when and where that child will not be participating in the general education setting with their non-disabled peers and why they cannot be participating in an inclusive environment. Accommodations. Accommodations are simply classroom and testing supports, such as extended time on testing, multiple test settings, breaking larger tasks into smaller tasks, doing check-ins in the morning with the child or check-ins at night. They're not specialized instruction. They're simply accommodations to support the IEP. And then service delivery is, for instance, if your child were getting speech language, they would have to put speech language, how much speech language your child would receive, how often the child would receive it. Likewise, if your child is being pulled from a class, a math class, to get pull-out instruction, intensive pull-out in a special education classroom, that would have to be noted. If a child is going to receive their special education instruction within the general education classroom, that too would have to be noted. So whatever services your child will receive through a special educator or a related service staff member, it has to be listed on the IEP, what that service is, where that service will be delivered, how many times per week, reporting period, etc. the child will receive that service, and each time for how many minutes. Again, you must give your consent to place. Okay, it must be informed consent. So the team can decide your child has a disability, but you have to agree to put your child into special education services. Okay, you must understand what you're signing. Okay, so it's got to be informed consent. Consent is voluntary. If you decide at the end of this process, no, the services they're offering, they're not appropriate for my child, I do not want to give my consent, you do not have to give your consent. It is 100% voluntary, and it must be informed. Again, I bring this up, prior written notice. It's really important. Make sure you read that. Again, if there is an error in paperwork, you need to contact someone at the school immediately. You need to tell them that your recollection of the meeting, your notes don't match their notes, and that you would like this to be corrected. Again, I would put it in writing so you have a record. Okay, so if your child is not eligible for special education, The team has the option of considering additional general education supports and services, such as the child being placed back in the MTSS process, giving the child informal testing and classroom accommodations, or consideration given for another type of formal plan called a 504 plan. A 504 plan is a legally binding document. The difference between a 504 plan and an IEP is more restrictive. A 504 plan is strictly accommodations. It falls under the umbrella of general education. All right, if you don't agree with the evaluation that the school district has done, you do have the right to ask for an independent educational evaluation. Okay, the district does not have to agree to an independent educational evaluation. If the school district believes its evaluation is appropriate, it must initiate a due process hearing. I have never seen this done. Usually, if the parent wants an independent educational evaluation, the school district does not want to grant it. There can be some negotiation, but if the parent feels strongly that the evaluation that was done on my child is inappropriate, the school district feels strongly that their evaluation was appropriate, the school district then has the right to start court proceedings under a due process. Okay, once you're in the EC process and going through the referral, going through the eligibility, having your child not found eligible, entitles you to what we call a mediation. It is similar to a facilitated meeting, but it's got a lot more teeth. You cannot get a mediated meeting unless you're in the EC process. Again, it's going to be a neutral party. It is sent, this person will come from somewhere in the state. They will have no affiliation to the school district that you are in, and it is of no cost to the parent. So this begins on all of the different evaluations. I'm not going to go through them, as I say, but every type of evaluation that the school district would conduct under federal and state law are noted in the remaining slides. The other thing that I wanted to point out was on the last slide, I give some resources that could be helpful. And the first one is the North Carolina Department of Instruction for Exceptional Children. And it has many, many, many wonderful things. It will have everything about facilitated, mediated. It will tell you what tests need to be conducted depending on the disability. It just has a wealth of information. So if you have question, it is a great resource. Also, they give a list of the various like Exceptional Children's Assistance Center. They're wonderful. They have free advocates that can help you. These advocates cannot go to meetings, but they can advise you outside of the meetings. And then they also have some online national and statewide resources, Council for Exceptional Children, and Special Education Parent Advisory Councils. So it's a very, very comprehensive website. I encourage people, again, if you have question, it's a great start point. So I'm sorry that I rushed through this. Again, the point of my presentation was to be more of a resource for all of you. So that when you're, you can go back and refer as you start through this process.
All right. Well, Andrew and Margaret, thank you so very much for your very thorough presentations. It's a lot to take in. I know it as somebody who's fairly familiar with the process, it's a lot of information, and speak a little bit, if you would, to parents or other caregivers who may be in the audience who are feeling overwhelmed by all of this. And not, I don't just mean your presentation. What I mean is the journey, and navigating all of this, and just any advice as someone is walking this path.
Well, I think, I think use this, there are advocates, there's educational consultants, but I think also use the school system as a resource. They are required by law to help you understand this process. I think it is a very confusing process, but don't be, like our kids, they're afraid to ask a question. When you get in these meetings, don't be afraid to ask a lot of questions, and don't be afraid to say, I don't understand this. What exactly do you mean? They are required. That consent, informed consent. If you don't understand, then you are not giving informed consent, and do not be embarrassed. I've done this for many, many years, and I get in meetings and they'll throw an acronym and I'll have to stop and think, what are they talking about? So, don't, they'll say PWN, that's prior written notice. Well, why would any parent who's just starting this process know what a prior written notice is? So say, what is a PWN? What is the point of a PWN? The other thing is there are some wonderful resources. The EC Parent Rights Handbook can be that the state puts out a little confusing. There is a woman, Jane Weddick is her name. She's at Duke Law Clinic. She has written her own EC Parents Rights Handbook. It is posted on, the internet, and I think it really debunks in a much clearer fashion what the school system is responsible for and what this whole process, it just makes it more streamlined. So I would encourage you to, if you do have questions, access, as I say, the state website, but if you still have questions, Jane Weddick's Parent Rights Handbook is wonderful.
Thank you. The next question I'm going to ask, I'm going to direct more towards Dr. Preston. And I wonder, Margaret, if you wouldn't mind opening the chat and putting that person's name in there, just so that somebody could use that as a reference. Dr. Preston, private evaluation and public school evaluation. Can you outline, if you're aware of, any differences between those two?
Sure, and Margaret probably has some things to add here too, since she's reviewed both of those. And I apologize that I wasn't specific earlier about this. Is I was discussing primarily private evaluations.
Sure.
In many cases, a lot of the test measures may be the same. A lot of the procedures may be the same during the actual test or the evaluation itself. I think the biggest differences are really kind of the goals of the different evaluations. So a public schools evaluation will not provide a diagnosis. That's not something they're able to do. And their primary goal is really to assist in this eligibility process to determine, do their results. Typically those reports themselves will not have recommendations, but they'll have, they will then refer back to the team to help determine eligibility. So I think a private evaluation is a little bit more standalone. The goal is partly whether or not there's a diagnosis, but again, also partly how does the child learn, a little bit more of a comprehensive kind of, I think, approach there. And then similarly, I think the recommendations in a private evaluation tend to be a little more comprehensive in terms of different settings, in terms of home and school and medical settings that could help the child. Is there anything, Margaret, that I'm missing that?
No, I think the biggest thing is that you have to keep in mind that a school district cannot diagnose. They can say that the child has the characteristics of attention deficit disorder. The child has the characteristics of, autism spectrum disorder. They can diagnose a specific learning disability. They won't diagnose. What they will say is it's a team decision. But if you need a specific diagnosis, a school district cannot do that. And so in that regard, I too agree that private evaluations are much more comprehensive because the school is very limited as to what they are and are not allowed to do. And especially if you suspect your child has mental health issues, because they're school psychologists, they're not clinical psychologists. Even if they're clinically trained, if they're acting in school, they cannot give mental health diagnoses.
There was something that went out in the chat from Vicky, who is a close friend of Hill's, and it's a site that also deals with legal issues surrounding special education, and that's put out by Duke. So we'll get that in the chat as well for other folks to be able to see. Quickie. Should a child take their medication for reevaluation?
I saw in the chat, it really depends. That's something that really would be a decision between with the parent and the clinician at that time, because there's a lot of variables there. It depends on how helpful the medication seems to have been. It depends on how long they've been taking it, if it's relatively newer or not. I think in the chat, it was more relating to ADHD medication. Many of them are, you're able to stop and start them safely. Other medications you're not. So certainly that's a factor. I would always double check with a physician. Is it okay if my child doesn't take their medication during a test evaluation? And it really also depends on the question that we're trying to address. So if we already have a well-established child, if ADHD is already pretty well established, and we're trying to see what else might be going on, then there may be some cases where the child would take their medication for portions of that testing. But it really does become kind of a case-by-case decision. So those are some general things to think about. But I would always make sure you talk to the clinician beforehand, and also make sure they're informed of, whether the child was on the medication or not during that time. And of course, it also depends on the child. Some children really can miss a dosage of medication and then get through the day pretty well. And for others, it can be much more impactful. So there's a lot of factors there, but it does depend on a number of things.
Okay. So bottom line, I guess, check with the evaluator before.
Yes, exactly.
Making a decision on it. Okay.
That's right.
If the school identifies the learning disability, and obviously not diagnosed, but if they make a decision, in other words, the child does need specialized services and put it in place, are they responsible for serving that child and providing that specialized education? This participant mentioned that it seems like the schools don't want to due to cost sometimes.
Yes, the school is absolutely responsible for providing those services. Cost should not be a factor. I know that's in an ideal world, but if your child has a disability, the school has identified a need for specialized instruction. In the eligibility meeting, it should be outlined as to what type of specialized instruction your child needs. They are absolutely responsible for providing that, no cost to the parents. But again, get that clearly outlined at the eligibility meeting. What types of instruction are you recommending? And I would recommend that you would have specifics. This would be more for a child who had some unique learning needs, more so than just, like schools are very good at dealing with specific learning disabilities, ADHD. I mean, they're known. Most schools now are very familiar with autism. It would be more like if you had a child who had severe vision loss or severe hearing loss and really needed specialized tools. I would get those clearly defined and noted somewhere in the team minutes, prior written notice on the IEP itself, so that you had something to go back to the school and say, this is what we agreed to hold their feet to the fire.
Okay, excellent. So in the MTSS process, if a child's making progress but still well below grade level, is there a possibility to get an IEP eventually after this process? Can this process be going on? You mentioned that the two can happen simultaneously
Yes.
earlier.
Right, it can happen. And that's why I put, don't let this be a stall tactic, because I've heard far too often where parents have tried repeatedly and it's always the MTSS that is stopping the process. So it can be done simultaneously. Also, if they say your child is making progress, but you still have concerns, classroom teacher still has concerns, you have the right as a parent to refer that child again to the EC team. It's not you refer once, they deny the referral, that's your only chance. You can refer as many times as you want. The other thing, I call this MTSS purgatory. I would get children at the high school level who had been in the MTSS process since middle school. And so often what they are getting in the MTSS process is specialized instruction. So as long as they're getting the specialized instruction and the supports, the child's making progress, accessing general education curriculum, and then as soon as they pull those supports, the child starts to take a nosedive. So they put them back in MTSS. At some point, you just have to, be forceful and say, like, hello, we've proven through the types of specialized instruction that my child can be successful. They've been put back in MTSS multiple times. They need specialized instruction through special education services.
Margaret, I want to make sure we answered another participant's question that is really closely related. So I'm gonna put this out there, and if it was you in the chat, please feel free to follow up if you need to. A child who has already been diagnosed with a disability, but is not receiving specialized services because they're making progress that's based on a rate of improvement metric that, like that last question, is unrelated to grade level expectations. And so it's sort of that dual track of, MTSS, yes, they're making progress, but if I look at where they are compared to grade level peers, there's no comparison to be made. And so specialized instruction is not happening, and that is the reasoning that the school is giving, is because they are making progress.
Yeah, and that is MTSS. That's why if it's a good school, you will be part of that process. They will have, usually it's every 3 to 4 weeks. They will meet with the parents. They will go over the progress with the parents, and that's where you have the opportunity to express your concerns. Those concerns should be addressed. Usually they will then add more interventions, more supports. That's the point of meeting every 3 to 4 weeks, to say, okay, this is working, we're still weak here. So they will add supports. But again, if you get tired of the MTSS process, you don't feel your child is meeting grade level expectations, yes, they're making progress, but they're not anywhere near grade level, you can again refer them to the special education team.
Okay. What can be done if a child is in a private school and the IEP isn't being applied?
IEPs do not, well, it depends. If your child needs a related service such as speech language, they may qualify for speech language or occupational therapy through a public school system. But if you have your child in a private school, the school district has no obligation to implement an IEP. Now, Hill Center is a little different if that's what we're referring to,
No,
because
I'm sure we're not, because you're required to have a diagnosis in an IEP to get in our school. So, yeah.
So,
So I think it's more just generally speaking, a private school.
yeah, if your child is in a private school, the school district, with the exception, there are some related services that your child may qualify for services. But otherwise, the school district is not responsible for implementing or monitoring an IEP.
And the flip side of that being that the private school is not legally bound to implement or monitor that IEP either.
Right.
It's not a legally binding document to them, as they don't take state or federal funds. So they're not legally bound by that. So, you know, you have to, if private school is desired, it's a great question to ask at the point of entry. You know, what services they do provide, and here's my child's IEP, would this be honored? You know, just some background information first. How often, there were a couple of questions about how often you'd recommend a reevaluation. If a child, in particular, one person asked if my child was assessed early on in elementary school. Do I seek a reevaluation within a certain period of time, or do I wait till some academic challenges start to mount or new difficulties emerge? Dr. Preston, what's your recommendation on that?
So again, this will be a little unsatisfying because I don't have, this is the exact time to do so, but I think it depends on a number of things. I think many times a school will request reevaluation about every 3 years. So that's one time where a school may be kind of the one who initiates that for a child. I think with younger kids, particularly if they're in kindergarten or first grade, and we're really looking at something we expect to change, like reading or writing or math skills, we may want to do a smaller targeted evaluation of just those skills. And that might be once, every year or every 2 years. So that might be a little bit of a narrower window. I think for other kids where the parent feels like the child is generally doing pretty well, but still has difficulties that they initially were concerned about, at that point, I would think about doing it before kind of bigger transitions. So you might do something, let's say if you had a child get an evaluation in second grade, but they've been doing pretty well overall, still think they need services though, you might then do something at fifth grade, or so that prior to going into middle school, or again, you might think about doing something at the end of middle school prior to going into high school. So again, it does really depend on the child. Sometimes we see a child early in elementary, and then we don't see them again until high school, because now they're trying to get different kinds of accommodations for standardized tests, or even accommodations for college. So it does depend on the child and kind of how they're doing with the accommodations. And certainly there's some children who have an evaluation early on and kind of learn skills and strategies that they don't feel that they need services any longer, and then there's not any real need to come back for an evaluation in that case.
Okay, great. Margaret, this is probably going to go a little bit towards you. Can you talk about just briefly the difference between an IEP and a 504, and does a 504 require an evaluation? I'm sorry, a re-evaluation.
Okay, so a 504 doesn't necessarily require an evaluation, but it requires a diagnosis. So typically, if you have a diagnosis, you have some type of an evaluation. The biggest difference between a 504 and an IEP, they're both legally binding, but a 504 is simply accommodations. Okay, there is not a case manager. It's under general education, as I said, and it's usually a counselor who oversees this plan. With an IEP, it's a much more comprehensive plan. Your child meets with an EC case manager on a regular basis as part of their services. They have accommodations along with annual goals that they're working towards. As far as reevaluation is concerned, it seems that some school districts now have gotten better with that they will have annual reviews with 504 plans, and they will have what is equivalent to a 3-year reevaluation. But the school district is never under a 504 plan responsible for conducting an evaluation to continue services. If you want an evaluation, that would then fall under special education, exceptional children.
Okay, and much like the process you described in your presentation.
And typically what I've seen, if there is a 3-year process and the child has ADHD, they'll ask for medical documentation, the physician who's treating them, or a letter from the diagnostician who diagnosed them with ADHD. It's a very different process than the IEP process. The IEP process will bring in, you two do not have to do formal evaluations every 3 years, but you have to bring a team together, an IEP team together, to discuss whether a reevaluation is necessary, and if so, what parts of the evaluation are necessary. And that is to the cost of the school.
A little bit related in terms of cost to the school. One participant was wondering, what are the scope of services in special education, and specifically mentioned summer school, placement in summer school, any after school services, tuition for enrollment in a specialized school. Does any of that fall within the scope of what could be on someone's service plan?
It depends. If the school is requiring the child to go to summer school, then they would be responsible for giving some type of specialized support and instruction. What that specialized support and instruction would be determined by a formal IEP team. After school, no, typically. I can't ever imagine where they would give supports for after school unless there was an activity that the general education students were going to participate in and the special needs child could not without extra supports. But that's more like, a Christmas program or a field trip, not if you've signed your child into after school care. As far as giving monies towards a specialized school, what you have to do is go through what we call a continuum of services, meaning you have got to give the school district the right to provide these services, exhaust all of the services they can provide. There are many, many meetings involved in this, and then you can ask for money. And you better have a very strong case. It has been done. I'm not going to say it's never done, but as I say, it's a very long, exhaustive process, and you have got to give the school district every possibility to provide services. And then you need very strong documentation to support that they have not provided these services. And then you would go in, that's when lawyers typically get involved and they figure out what needs to be done. But it's not typical. I mean, you can't say my child's not making grade level progress, and let's say they need to go to the Hill Center to do so, and we want money for that. The school district's going to say, yes, we can provide the services.
Okay. I'm wondering if, and I think you've pretty well touched on this. I wonder if the after-school services that this particular participant meant, I wonder if that's like a tutoring kind of a situation.
No,
Yeah.
they would not. And some schools will allow private tutors to go into after school, and some school districts will not. The reason they will not is the liability, because that person is not insured by the school district. So if something catastrophic happened, it opens the school district up to liability.
Absolutely. I noticed, Brenda, I see that you are still on here as a participant, and I'm looking at your question, and I want to ask it because I think it's really interesting, and I don't know the answer to this either. But you have the acronym FIE, and I'm hoping, I don't know what FIE stands for, and I'm wondering if it was just a typo and you meant IEP. So I'm going to ask the question using IEP, and then Brenda, if I have that completely wrong, throw something in the chat and let me know. Brenda's question is, can a school district write an IEP for a student who disenrolled from the school district 30 days before the IEP was written?
So the child, I'm assuming that the child was eligible for services.
I am too.
Okay.
Yeah, I'm making that.
So if the child were found eligible for services, depending on how long they had been disenrolled. So if you're talking about your child was found eligible for services, you disenrolled them 30 days before an IEP was put in place. Now you're coming back 2, 3, 4, 5 years later saying, I want that IEP to be put in place. The school district is going to say, we need to start the evaluation process over. They wouldn't necessarily have to do every evaluation, but they need current information to see if the child still qualifies for an IEP. So that would be dependent upon the length of time the child had been out of the school district and when the evaluations had been completed. But if it were a matter of the child was found eligible, parent disenrolled, then they move back to the district 6 months later, the child should easily, you convene an IEP team and you write the initial IEP, you note what had happened and just move forward with services.
I've got further information. It's a functional independent evaluation.
So what do they mean by functional? I mean, there's functional independent evaluations that children take for driving. If they're physically impaired, there's functional evaluations given for children who are visually impaired. There's multiple functional evaluations.
Okay. Brenda, I think I just gave you permission to talk. I'm hoping you're able to come off of mute to further explain. I want to make sure your question gets answered, but I'm not sure I'm relaying it well. All right, we'll see.
Hello.
Oh, there, yay. Okay, Brenda, go ahead.
Hi. For example, I could have we see so many acronyms that I might have the wrong term.
Right.
But I was referring to the evaluation, that cognitive assessment that, that determines the continuation of the diagnosis and services.
Okay, so I'm still not clear. So does your child currently have an IEP?
Yes, IEP.
Okay, so your child has an IEP, and what type of evaluation are you requesting that the school do?
Well, actually, after several years, it's after 3 years, he was recommended to do another evaluation, but in between that time, we disenrolled and moved on to another, because we moved to another school district, another town. And during that transition, I received communication from just sort of like a follow-up from the previous school district saying that they have performed an evaluation, a full individual evaluation, but that had been 30 days after he had no longer been there. And that totally confused me. As a parent, I just didn't know what to do.
Okay, so what happened was they, correct me if I'm wrong, you had an EC referral meeting. They decided to move forward with an evaluation because they suspected your child had a disability. It sounds as though that you then came back together and your child was determined as being eligible for special education services, but they had not yet written an initial evaluation. So when you move to the new district, what that could have been is if it was in the state of North Carolina, your child was then eligible to receive those services in the next school. And so that would be an attempt, I would think, of the school trying to communicate with the new school to say, we've done all these evaluations, we have found the child to be eligible, and we were in the process of writing an initial IEP when the parent moved to your school district, so that they could then, as I say, move forward with the initial IEP and get your consent to place the child in special education services. But, I'm assuming you gave your permission for the evaluations to be done. And just by moving doesn't stop that process. There's still, unless you put it in writing that you want to stop that process. So when your child moved to the new school district, I'm assuming they got special education services, correct?
Yes, the
Yeah.
IEP continued or yes, took place.
Yeah. So have I answered your question?
Yes, you explained it in a way where there was a sequence. Yes, it made sense. Thank you.
Okay, good. I'm glad. So that's what I'm suspecting why the school district wrote you, just to let you know that, the evaluations had been done and that his services could be given at in the new school district.
I want to correct
Thank
something. Oh, sorry, Brenda. Thank you, Brenda, for doing that and clarifying. That was really helpful for you to come on and do that. I want to clarify something I said just a few moments ago when we were talking about IEP and diagnosis and private schools. While Hill is an independent school, students are required to have a diagnosis of a learning difference or an attention challenge in order to enroll for the Hill School Day program. But they are not required to have an IEP. We have students that come from private schools and are homeschooled who don't necessarily have an IEP but do have a diagnosis. So I just wanted to clarify that. And thank you to the person who asked the question in the chat.
I would like to say one thing though. If your child is in a private school, or if your child is being homeschooled and you suspect the child does have a disability, you can request that the school district conduct those evaluations. They are responsible for doing that. And typically it is the school district where the private school is housed. So if it's homeschooled, it would be the child's homeschooled within their district. But if they're in a private school and you want the school to conduct the evaluation, it is typically like, the Hill Center is in Durham. So it would be the Durham School District that would be responsible for conducting that evaluation. And that likewise would be for OT, speech language, any type of evaluation that you felt your child had a disability. So that may be what some of these questions are about, and I just didn't clarify it. My
Thank you.
apologies.
No, I appreciate that. That's great. So I've got one final question. Does a typical evaluation, Dr. Preston, would that reveal that a child is twice exceptional? And could you talk just a little bit about what twice exceptional is, and does a typical evaluation reveal that?
Yeah, so that wouldn't be something that would necessarily appear as we wouldn't necessarily formally identify a child as twice exceptional in sort of a diagnostic way. But the idea of twice exceptional is a child who may have some sort of very high scores or abilities in one area, and then also still qualify for a learning disability. In which case, we do run into this sometimes with schools where there may not, there may be some difficulty of they're focusing too much on one side or the other, in terms of not necessarily recognizing the child's giftedness, because they're focusing more on the difficulties the child's having. So certainly what we would encourage, the evaluation itself would look again kind of at that concept of strengths and weaknesses. So not just looking at difficulties, but also areas of strength. And typically, when we think about twice exceptional, we'll think about higher intellect. So we do look at intellectual abilities with most of the evaluations we do. And I think the goal of the report or the goal of the evaluation would be then to point out or make clearer to schools, make a case to schools that though a child may need supports in one area, they should also be recognized for those gifts they may have or other abilities. So certainly children can both be in sort of an academically or intellectually gifted or AIG classes, but also still be receiving interventions or accommodations in other areas. So they're not mutually exclusive. But I do think it does get tricky for schools to understand that at times. So again, we don't necessarily formally say this child is twice exceptional in the report, but we could certainly discuss those strengths and weaknesses with parents and also with school.
Yeah.
And if I could just interject that most school districts have their own testing and protocols for identifying 2E students.
Thank you. All right, well, I'm kind of glad to know not much has changed since I was immersed in the public schools. That the process is still very much the same, and that answers I have given to parents in the past are still ring true. I do want to thank both of you, Margaret, Dr. Preston, for being here with us tonight, for giving so much of your energy and time in preparing for this and in your presentations and answering these questions. This is such important information. This journey isn't an easy one for adults or for children, and I just really appreciate the work that both of you do to help people along that journey and that pathway. This has been really enlightening and helpful. So thank you so much.
You're very welcome.
You're welcome.
To the participants, thank you all for joining us here at Hill for this tonight, and wish you all the best.